Today I've got a special guest with me, Richard Ray. He's the founder of R&S Health and Wellness Consultants. He's joining us from Texas. Tell me a little bit about your company, Richard.
Yeah, so thank you, Dr. Chan, for having me on. R&S Health and Wellness is a company uniquely designed to not reduce, but eliminate health disparities. We understand that in the African American community, the outcomes in healthcare are not equivalent to the standards that America actually has set for white Americans or the majority class. When you look at the fact that the poverty level from the 1970s is still the same in the African American space as it is today, there is a problem. When you look at the fact of the Tuskegee experiments that happened from the 1940s until the 70s, the residue of that is still alive and well. When you look at the fact that currently there's legislation in different southern states to limit the access to voting, there is a problem. And then when you look at the fact that African Americans are disproportionately affected by access to health care, there is a problem. And it's not simply from the politicians, because we've had a Black president, we've had several Black African American, however you choose to say that, politicians, but the plight of life for health for African Americans has never changed. I have a story from when my father, who's currently my medical director, Dr. Douglas Ray Bro, he's an author, a pharmacist, and a physician. When he was 5 years old, walking home in Jennings, Louisiana, which is southwest Louisiana, he was walking home on a dusty road coming from school, and as he was approaching his home, the shotgun house that they lived in, everyone lived in a house together, the 3 generations of family, right? So my grandmother and my great-grandfather, which is my father's, older family, everyone was in an uproar. Well, when my father got into the house, everyone was loading up the truck because my father's grandfather was actually having a stroke, but he didn't know that at the time. So they all loaded up the truck and they went to the local hospital and they pleaded and begged, and no one would see them. So they drove from southwest Louisiana all the way to New Orleans, which is across the state, which is about a 5 or 6 hour drive. And no one would see my grandfather, my great-grandfather. And my father was in the truck crying and weeping and trying to understand, why wouldn't these people see his grandfather? Well, subsequently, he passed away. But from that story, from that allegory, which paints the picture of my family, my father became a physician, an author, and a pharmacist, all with the goal to eliminate disparities. So from that story, I have actually developed R&S Health and Wellness. Now, our goal and mission is not to generate the most revenue or to be in the most astute places, but our goal and mission is to walk hand in hand with individuals who don't have access to healthcare, who have resources, but they don't have access. When you think about the man or the middle-aged man, African-American man, who goes to a urologist, and the urologist does not want to touch them to do a digital rectal exam because they say they look all right, and the urologist lets him walk away, knowing that that patient has a family history of prostate cancer. We also know that when individuals in Mississippi have a wound or an issue with their leg from diabetes, the first option of care is amputation. Now, there is a problem there, Dr. Chan, and we at R&S Health and Wellness have developed a number of partnerships with the National Medical Association, with historically Black colleges, with every entity that is open to partnering with us, with the goal is to eliminate health disparities. I hope that kind of gives you a crux of kind of what we're talking about.
Yeah, that's a really powerful story, Richard. Thanks for sharing. I mean, talk to me a little bit about how do you guys go about educating these these communities? What does that
Yeah.
look like? Before COVID, and then I'm sure now it's changed a little bit after COVID as well.
Yes. Yeah. So before COVID, we were actually setting up wellness events in local churches, different civic buildings, where we'd actually get the men from the community, the families from the community to come together and listen to a local physician that had a heart to educate and empower. So we actually very closely vet the physicians that we get to speak, because the worst thing that we could do is have a physician speak, but then wouldn't have the compassion to follow up with the patients, because we know there's a disparity and we don't want to contribute to that. So we get local physicians in the local area to speak to patients, address their questions, and then also empower them with hope, because there are so many individuals in the African American community that thinks that it's just that you're gonna, as you live, you have to have high blood pressure, that you have to die from cancer, that you have to have diabetes. But that is what we address. That is not how you live the abundant life. So we give them all the tools and education to show them that your decisions matter. If you practice proper spirituality, if you practice proper nutrition, practice proper hydration, get adequate sleep, exercise, do all those things that keep the body in homeostasis, you will live a wonderful life. But at the same time, you must embrace your health. Lazy people aren't healthy. It takes time, energy, and education to keep your body healthy. So we empower them with all that education and information. So that's a little way, one of the small ways that we do that. But not just education, we actually connect them with resources. So once you leave the event, you understand what your next step should be. You understand, you have the doctor's information. You understand what websites that we have vetted to make sure you have all the education you need to be empowered to maximize a great health outcome.
And then what are you guys doing now that we can't actually meet in these meetings?
Yes.
How are you guys getting around that issue?
So just as physicians are doing telemedicine, we are doing Zoom or Teams meetings. So we actually have a network of physicians that we dispatch to talk on our Zoom or Teams meetings, and we talk about the most common ailments that are affecting African Americans. Now is COVID, right? Obviously, but we also see that COVID has disproportionately impacted the African American community. Why? Because we were already the sickest part of the community of America, and then when you couple COVID on top of that, you're almost guaranteed to get poor outcomes. So as we teach, as we empower, as we show individuals in the African American community that there is a better way to take care of yourself with healthcare, then we are actually starting to see the fruits of our labor. One of the things that we do that is very simple. So when we talk about nutrition, we always say, read the labels. And if you can't pronounce it, don't buy it. If you buy a bag of Frito chips and you have monosodium glutamate and you're not sure what monosodium glutamate does in the body, don't buy it, right? So try to get one ingredient foods. We talk about broccoli. We talk about getting all those phytonutrients to keep the stomach healthy, right? We also know that for men, the most important thing is an erection. Well, if you can keep your body in a healthy state, exercise, regular appointments with your urologist, making sure that you have a healthy diet and making sure you're getting adequate rest, all those different things to keep a normal level of testosterone, to keep your adipose tissue down to a minimum, you can live a healthy life with an erection. I have not read anywhere where your body's supposed to not provide an erection if you keep it healthy. Now, you won't have the erection of a 15-year-old, but you can have an erection throughout the majority of your life. So we're excited about sharing that information. And thank you, Dr. Chan, for in previous times helping us to connect, to educate guys on how to get the best erection. Because at the end of the day, if you're not alive, your erection doesn't matter.
That's so true.
Yeah.
Well, talk to me a little bit like about if somebody who's watching this video right now, thinks, well, hey, I want this education for my church or fraternity, or, community where I'm at. Like, what's the best way for them to kind of reach out to you, to kind of, talk about it and see what you guys can do to help that community out?
Absolutely. So I can be reached on LinkedIn, Richard Ray, or you can reach out to my contact information that you can post after this event. And because at the end of the day, our goal and mission is not to reduce, but to eliminate health disparities, because we'll actually make America a better place. When you have everyone in America healthy and whole, then we will have a more robust America. Then we can be that melting pot that our forefathers actually designed to be. Because if we have a segment of a population that America has to drag along because they're healthy or sick or can't facilitate good health care for them, then it'll drag down the entire America. So our goal and mission is to eliminate disparities, to make America a better place, but we have to address the issues of disparities, because it is not acceptable to not have adequate grocery stores in all of our communities. It is not acceptable for physicians not to want to touch individuals when they know they have a history of prostate cancer. It is not acceptable for, in America, patients to get their first option if they're diabetic and have a wound for amputation to be the solution. That is not acceptable, and our goal and mission is to eliminate all of those issues that affect our people.
And then lastly, just to kind of conclude, like, what one message do you want someone to take away after watching this interview?
Yes. The one message that I want everyone to understand is that there are challenges in healthcare. There's no perfect system. We understand physicians do the best they can. We understand there are challenges, but you are responsible for your health. We must educate and empower ourselves with the best information to get the best outcomes. And we have 4 basic pillars, and I'm gonna reiterate those: spirituality, hydration, nutrition, exercise. And the 5th pearl is sleep. If we can actually maximize those 5 pillars, then we actually can go a long way in having a better health outcome and live the abundant life.
Oh, that's awesome. Well, thanks so much, Richard, for spending the time to chat with me today.
Yes, my pleasure.